We are presenting a poster here of a preclinical data that is going to lead to a clinical trial of a novel combination, and the combination is with a FLT3 inhibitor Quizartinib with a MDM2 inhibitor. So Quizartinib as a single agent looks effective. However, the problem with this is if you cannot get the patient to transplant, which unfortunately ends up being a large population, almost 50 to 70%, for various reasons. They don't have a donor, they may be too old for a transplant, they may have comorbidities or infection that rules out transplant. In those situations, the duration of response with both Quizartinib and Gilteritinib, the two very potent second-generation inhibitors, is between 14 to 18 to 19 weeks. So this is not really a big home run if you look at the duration of response. So a lot of efforts that are ongoing in the United States, especially at MD Anderson, are how can we use these targeted therapies but further enhance their value so that they really transform the disease in some of the patients. So one of the agents that we have seen, at least preclinically, seems to synergize very well with the FLT3 inhibitors is an MDM2 inhibitor. So we have worked with Dr. Michael Andreeff, who has done a lot of work on this for many years, and we did preclinical studies both on multiple different cell lines, about 10 different AML cell lines, including a majority of FLT3 mutated cell lines, but also some FLT3 non-mutated cell lines. And we saw that the combination of the MDM2 inhibitor Quizartinib didn't improve the per se response rate, but it did improve the duration significantly of response in the mouse models. And so based on this data from the cell lines where we saw synergy, as well as multiple IV-PDX models, which we're presenting here, there is actually a phase 1/2 study of the Quizartinib as a single agent in the relapse setting where it will be approved in that similar indication. But now we're adding to this the MDM2 inhibitor. So I think now that we're combining these, especially that we see that there is a lot of preclinical synergy, we think we may be able to really improve maybe the response rates. That would be good, but more importantly, can we get the duration of response from that 14-16 week to 25-30 weeks or even longer, and then improve the effectiveness or value of these agents. So that phase 1 study is open in about 12 sites in the US, and if we see promising data as well as good safety signal, because when you combine two novel drugs, you always have to be afraid of myelosuppression. So we're going to do a cautious dose escalation, but then if it looks good, this may be one of the paths to expand quickly FLT3 inhibitors. The other studies that we're looking at in the same approach are combining these second-generation FLT3 inhibitors with venetoclax, and there's also a lot of preclinical data showing that there's potent synergy with this combination. So I think you're going to see this a lot in the next 3-4 years. Novel agents, novel with chemo, novel with hypomethylating agent, and hopefully some of these will significantly improve the outcomes for patients.